This problem affects about 15 million American women. It's painful, it's embarrassing. We're talking about an overactive bladder. And like many of you, Raquel has dealt with incontinence for years.
I suffer from a major incontinence known as urge incontinence, a form of an overactive bladder. It can be painful and it's very inconvenient. I'm a nurse, and when I have to do patient care, I'll often have bladder contractions and they require me to stop what I'm doing. Small amounts of urine can cause the contractions to happen, so it's not really relieved by going to the restroom. I have to wait for the contractions to pass. I have bladder contractions up to a dozen times a day. I'm only 25 and I feel like I shouldn't have to deal with bladder issues.
Hi Raquel. Last time I talked to you, the medicine wasn't working real well and we doubled the dose. So what's happened since?
I'm still having the urgency, but it's decreased, it's just not gone.
There's a new treatment available, Botox in the bladder. So in order to see if you might be a candidate, we need to go ahead and do some urodynamic testing. So let's go ahead and get that done today. We're going to actually fill up your bladder with this contrast dye so that we can take an x-ray picture during filling and some x-ray pictures while you're peeing everything out. So I'm going to start filling you up. I want you to let me know when you're starting to get an urge to go and when you feel like you can't hold anymore. All right, I'm seeing spasms just like you told me, and clearly the medicine is not working for you. So I think you'd be a great candidate for Botox. So I'm going to start the injection now. And we do a series of 20 teeny tiny injections. We're just going to be injecting a little bit at a time every time. You're halfway done almost. All done.